I'm Tara Brandner, and this is Hopeful Hints, an infertility podcast where you will receive quick, hopeful hints to guide you through infertility. Here, you will find education, inspiration, and most importantly, find peace as you walk through this journey to fulfill your family vision. Today's episode is brought to you by Protea Nutrition, Dr. Brandner approved. Protea Nutrition was designed specifically for women and encompasses all fitness and wellness needs without including harsh stimulants or artificial ingredients. And the best part is many of the products can be used in pregnancy and while breastfeeding. What you see on the label is exactly what you get. Nothing hidden. No special mixes, just science-based ingredients at effective doses, keeping your long-term health in mind. Check out the link located in today's show notes to check out all of Protea's supplements, including my favorite fertility-friendly products. Welcome to Hopeful Hints. I'm your host, Dr. Tara Brandner, and today we are going to continue our month of March special series on endometriosis. And today we're going to talk about 5 common signs and symptoms of endometriosis and things that should alert you to have a discussion with your healthcare provider or find a healthcare provider who understands and works with endometriosis. So let's begin. Right off the bat, one of the number one symptoms of endometriosis is abnormally painful abdominal cramps or pelvic pain with your menstruation and monthly cycle. And typically what goes along with this is heavy menstrual cycles or flow for prolonged days. And this can be the first day, the second, third day, or on into your period. So one of those alone or a combination of them together is typically a sign. Now, some of you may remember and have to think back to high school because some of you have been on birth control since high school or you got placed on birth control because of these symptoms alone. And so I want you to stop and pause and not think about necessarily the periods you're having currently, but think about the periods that you had starting in high school, starting with your first few years of having a period. Or perhaps you were on birth control and you came off of birth control. What were your cycles like then? Are you somebody who had to miss school? You were constantly having to change your sanitary products? Think back to that. It can change and progress and kind of look differently as we get older or as we come on and off of birth control. So that is typically what I tell my patients. I want to stop and have you think back further to your early years. If you were somebody that fit that description. Number 3, pain during and or after sexual activities. This is not normal to have pain during this. This should be an enjoyable time, not one where there's pain involved. Number 4, difficulty emptying the bladder or bowel and or pain with this, whether it's during your period or outside of your period. Rectal pain, pelvic pain, vaginal pain, anything like that where you have pain and it doesn't have to be every month. It can be during your period. It can be outside of that period. Really just any pain with those two, with bladder or bowel activity. Infertility, enough said. If we have infertility or the diagnosis of unexplained infertility, we really need to dig deeper and rule out endometriosis truly being a cause of your infertility. Pelvic or abdominal pain that's not associated with your period. Now I'm going to give you more than 5. That was 5 right there. We're going to keep going. Those are my top 5 signs right off the bat that I would look at and be like, you have endometriosis more than likely, or please go have a discussion with your healthcare provider about your symptoms. But let's keep going. So number 6 would be pain not associated with your period. If you're somebody who is having this nagging, coming and going, or worse yet, constant pain, lower abdominal area, low back, rectal, pelvic floor area, we need to have a discussion about endometriosis. In addition, number 7, low back and or leg pain. Unless you've had an injury or you've had something else discovered, endometriosis needs to be considered as a possible cause of somebody who continues to have intermittent low back and or leg pain with, or I should say during or outside of your menstrual cycle. Number 8, stomach problems, including nausea, bloating, diarrhea, and or constipation. Once again, with or without your cycle, I see this very commonly with my patients. A bowel movement changes, so you'll all of a sudden have diarrhea, or if you do have a bowel movement during your menstrual cycle, it is more painful. That is my case as well. Bloating, it looks like you're pregnant during your period. All of a sudden, poof, there it is. We have bloating going on during our period. Now, some of that is common, right? It is bloating that is like, what is going on, or bloating that stays along with other symptoms when you're not on your menstrual cycle. In addition, number 9, having fatigue. Having this chronic fatigue along with any of these symptoms, and you've had everything ruled out, you've had a true deep dive hormonal workup, and which if you did, you'd maybe find some symptoms that would look like or could be diagnosed as endometriosis with some estrogen changes, but that's a whole nother topic. But this chronic fatigue we'll see with people that have endometriosis. And number 10 is some mood changes. It is not uncommon to see those with endometriosis have anxiety, depression, and some of it's from these symptoms just being overlooked, the frustration, the pain. Living with this chronic pain all the time will lead to mood changes and fluctuations that happen. Once again, I want to remind you, why is there pain with this disease? Because there's inflammation and irritation that occurs when there is blood touching any organ or scar tissue that can occur from endometriosis and create pain in other various locations. I really want to encourage you to find somebody who understands endometriosis, have a conversation with them, and create a healthcare team approach to this. Find multiple people to be part of your team to help take care of you. I'm going to talk more about that when we talk about the treatment aspect of endometriosis, but this may look like your OBGYN, in addition to your family care provider, in addition to a pelvic floor physical therapist, in addition to acupuncture and a naturopathic provider. You can create a team approach to helping you manage these symptoms. Think outside of the box and advocate. I always encourage my patients, and I had to learn this the hard way with myself, but to continue to advocate until you feel you've been heard, that your symptoms are being managed, that you are not being overlooked, and that you don't give up. If you are sitting listening today and you're somebody who felt perhaps like you're not heard or your symptoms continue to be overlooked, I want to encourage you to reach out to me. I am here for you to help you work through this and find a healthcare provider who can help you with your symptoms. In today's show notes, I've linked one of my favorite endometriosis resources, Nancy's Nook, to help you guys better find some solid education on this topic. Thank you for listening. I'll see you back here next week and all month long, where we are talking about all things endometriosis. If you enjoyed today's show, please head over and hit subscribe or leave a review for Hopeful Hints and Infertility Podcast. Thank you so much for listening, and we'll see you back here next week, Tuesday.